Awesome. So thank you for joining us here this morning. I'm going to talk a little bit about ARTA and our ARTA benefit plans. So a little bit about ARTA. ARTA was founded in 1963 as a provincial association for retired teachers. We have over 30,000 members and we cover about 41,000 lives. We've been the sponsor of our ARTA Retiree Benefit Plan since 1995, and we've recently expanded to include other similar groups. So we don't only have groups such as retired teachers, but we also have different public-private groups that we offer our benefits to that have the same risk averse as retired teachers. Our provincial office here is in Edmonton, which is where all of the ARTA staff kind of have our offices there. If you can't get to Edmonton, you can make an appointment online to do so virtually, but we also are opening up a satellite office in Calgary pretty soon here, probably in April, I believe, where you can also go in to sit down and have appointments with our staff. So that's all on arta.net, where you can go and schedule appointments either in the Edmonton office, the Calgary office, or virtually to sit down and ask questions. So a little bit about ARTA's membership advantages. There is an annual fee to becoming an ARTA member. That fee for a regular membership is $50 a year. As a regular member, when you do retire and join our benefit plans, your first year of retirement is free for that membership. And as an ARTA member, you are not only eligible to join our ARTA Benefits Plan, but you also have some access to several of our membership advantages, which are what I'm going to go through here. So we have wellness initiatives. So these are physical and wellness events hosted throughout the year to keep our members active and engaged. We have a photo contest that's happening right now if taking photos and photography is your thing. We have a travel sector, a nature sector, a color sector, and a detail sector. And we have novice and master. So those are really fun for people to join if photography is their thing. We do physical wellness initiatives. So this year we're doing wellness walks in April. We'll be throughout the province hosting wellness walks for our members, about a 2 to 5 kilometer walk in different areas in the province, just getting people out for conversation and getting active. And then we also do a writing contest as well, as if writing is kind of your forte and you like doing that, we have contests for that too. We also have a scholarship program. So scholarships go to students who are related to an ARTA member. Our annual scholarship program awards 8 students continuing their post-secondary studies with $5,000 each. And then we also award 2 scholarships of $2,500 annually to ARTA 101 members and their direct relatives. This is a really great way for any family members of ARTA members to get potential money for university. It is pretty expensive. So these scholarships recognize academic achievement and community involvement and in volunteer work. Those who are interested in applying for a scholarship do have to kind of write up a letter, talk about their future goals, personal accomplishments, letters of references, and everything like that for us to determine the scholarship recipients. And advocacy. So ARTA has a bunch of resources and support at the national and provincial levels, protecting the interests of educators and seniors here in Alberta. And then finally, one of our membership advantages is our member discount program, ARTA Perks. This we recently brought in-house, so we have access to discounts for ARTA members from a large variety of businesses. We have over 60 discount partners. Some of them include Broadway Across Canada, the Canadian Brew House, the Clique Hotel Group, Bell, Good Life, Park to Go, Soft Mock, Magic Bus. That's just a few. We also have started getting massage places, chiropractic places that are looking to offer discounts with our members. We have travel, car rentals, everything. It's really great. If you use your membership, if you use your ARTA Perks maybe 2 to 5 times, it honestly, the amount of money you save pays for your ARTA membership in the long run. So that's kind of a little bit ARTA membership. So I'll start talking about our benefit plans now. So as I mentioned, our group plan was established in 1995 by retired teachers for retired teachers. We are a nonprofit organization. So every dollar that goes into ARTA, every dollar that comes into ARTA goes back into paying the claims and ensuring we are offering the best benefit plan for our members. Some plans do offer you a discount for whatever reason. ARTA does not offer a discount because we do not have any margins built into our premiums. And finally, because we were created by a group of retired teachers who wanted a benefit plan more conducive to a retired teacher's lifestyle, our travel coverage is unique and competitive because we found that retired teachers just enjoyed traveling. So that is one of our key things with our benefit plan. So a little bit about ARTA's benefit plans and the eligibility. So you have to have contributed to a pension plan, so an Alberta government-sponsored pension plan for 5 or more years. You need to be an ARTA member, so all participants must be that ARTA member, which is at $50 a year that I was talking about previously. You need to be a Canadian resident. So Canadian residents are covered, anyone who's covered by the provincial or territorial health insurance in their province of residence. So that means if you retire in Alberta and you decide you want to move to warmer weather throughout Canada, you can, and your ARTA plan will follow you with you wherever you go. The only place that the ARTA plan does not go to is Quebec, just because their provincial health plans do not work in tandem with our ARTA benefit plans. There are no age restrictions, so you can join at any age and you can remain a member for life. So we have no termination age on our benefit plan. And then eligibility of dependents. So surviving spouse and partners and dependents of the deceased are always eligible members. So if something was to happen to the primary member of the plan, if you hadn't applied for ARTA yet and something was to happen to you, your spouse, partner, or dependents would still be eligible to join ARTA. And the same works as if you were already on our benefit plan and something happened to the member that was eligible, we do not terminate. So the spouse, the partner, or the dependents who are on the plan would still always be eligible to continue on the plan. So a little bit about our application procedure. So if you know you are retiring in the future, we encourage you to submit your application as early as 2 months in advance so that we can process it and ensure that you have no lapse in coverage. If you choose to wait until you retire to apply, eligible members have to submit their application for health and emergency travel within 60 days of losing your group coverage or your spouse's group benefit coverage. The reason we say that is if you submit your application for health and travel after that 60 days of losing your group benefits, then you're subject to a medical questionnaire through our providers. Depending on your health, you may be rejected for that travel coverage, which is why it's really important to just apply within that 60-day window so you don't even have to worry about filling out a medical questionnaire and or getting rejected for the emergency travel coverage. We do state that if you are looking to retire, you're losing your group benefit plan, but your spouse or your partner is still working, we suggest that you join your partner's spouse's plan. That saves you money. You don't have to then pay for benefits on your own, and their plan might just be just as good. But again, the same rules apply. Once they go to retire or lose their group sponsored benefit plan, you have that 60-day window of your spouse's group benefits to apply without having to fill out a medical questionnaire. And the same goes for sometimes people decide that they are going to do some part-time work once they retire. So if you do some part-time work and your new employer offers group benefits, definitely take those. And then once you're about to lose those again, you have that 60-day window to apply before you would have to fill out a medical questionnaire. So when ARTA receives your application, your coverage will be effective on the first day of losing your previous group coverage. So there is no lapse in coverage, which is super great. We really want to make sure that happens. So that's why we kind of tell people to apply earlier so there's no worries. We never really have any problems, but that's why it's always good to apply earlier so you have everything set. but the day that you indicate on your application form that your group benefits are ending with your company, then the next day is when your ARTA retiree benefits will start. So a little bit about our plan and our plan options that we have. ARTA's plan offering is now more comprehensive than it ever was before. We recently introduced our comprehensive plans for members that are under the age of 65. We understand that not everyone retires at 65, so these comprehensive plans offer a little bit of everything with higher prescription drug maximums and all of that. Then we have our build your own plans. So the build your own plans specifically work in tandem with the Alberta Coverage for Seniors plan. But again, if the build your own plan works for you and that's what you want, you can take that no problem. So we'll talk about our comprehensive plans a little bit here. So these are specifically for those that are under age 65. If you're lucky enough to retire under the age of 65, then you might want to start looking at these plans. And then once you turn 65, we actually reach out to you letting you know, and then you would have to transfer over into one of our build your own plans. But our comprehensive plans include emergency travel, include dental, and have everything here. So I'm going to kind of go over a quick view of everything. We don't list everything included in the plans when I'm going over the comprehensive plans or the build your own plans. But at the end of the presentation, I'll let you know where you can go if you want to look more in depth in the plans. This is just kind of the things people ask us about the most. So there's 3 levels of coverage for our comprehensive plan. Core health being the most basic, and then enhanced health being the most comprehensive with the higher maximums. All of our plans have single, couple, and family care options. And annual maximums are per covered person, meaning each person receives the annual maximum. So as you can see here, for overall annual maximum, you have about $10,000 to $15,000 for our more enhanced plans. Our prescription drugs are all covered 80%. You have $1,500 up to $5,000 a year. Our paramedical services, it's really great to note, it's an annual combined maximum. So for example, let's say you have $1,000 to use and you hurt your back and you need to spend $800 just purely on massage. You can do that, but then you know that you have $200 remaining to spend on other practitioners. It's really good to have the paramedical services. We know that only about, on average, people use 1.5 practitioners a year. So whatever you feel like you need to use for your paramedical services, you can. We cover up to 12 different practitioners. So that's also really great. Some plans don't cover up to that many. And we really want members to use their maximum on what practitioner they want or they need. So I know right now, like for my personal plan, I never really use my chiropractor maximum. So I always feel like I'm losing out on that money. With ARTA's plan, you don't have to have a fear of missing out or not using your money in the spots you don't want to, because that paramedical services, that combined maximum can be used anywhere. So for core health, you get $750 a year, essential health, you get $1,000 a year, and enhanced health, you get $1,500 a year. Diabetic supplies is its own separate maximum. So that's really great for anyone who's insulin dependent or diabetic. Having it a separate maximum aside from the prescription maximum is great. For core health, you have 1,750, and that's for essential and enhanced health as well. And then all these plans do include our emergency travel, which I will talk a little bit more about later, but that's 92 days per trip, no stability clauses or pre-existing conditions. And then we do have supplementary travel available for up to 212 days. It's a lot to look at first. We know that people might not know what you are needing for a benefit plan. So one of the things we do tell people is, especially for your prescription drugs, go ask your pharmacist what you're using for prescription drugs, because it usually just gets paid through your benefits. You don't have any idea of what you're needing. So you go ask your pharmacist, see what kind of coverage you need. You can pick whatever coverage level, that's no problem. But once you pick a coverage level, you can move up at any time. So if you're deciding, you know what, let's just go with core health seems the most basic, but you're hitting your maximum levels pretty often, then you can move up halfway through the year anytime you want. You can move up in coverage. So you can move up to that essential health and have more money there. But once you are moving up, you are just locked in for 24 months there. So move up in coverage anytime. We have members that do it all the time because they never know what to start with, but then you are locked in for that 24 months. Our comprehensive plans also include dental. So a little bit from core, essential, and enhanced. They have the same for basic, preventative, and minor restorative work. That's your x-rays, your examinations, your cleaning and polishings, and your fillings. For major restorative work, your dentures, your implants, your crowns, only enhanced health covers that up to 50%. And then again, for orthodontics, only enhanced health has 50% for up to $2,000 a lifetime maximum. And then the overall maximums for each are just a little different from your basic to your more enhanced options. And like I said, those ones do include emergency travel. I'll talk a little bit about those more here in your build your own plans. But our build your own plans work in tandem directly with the Alberta Coverage for Seniors plan. So the Alberta Seniors Drug Plan will cover 70% of prescription drugs listed on the Alberta Drug Benefit list. The copayment then that you are responsible for is 30% of the drug cost up to the maximum, which I believe is like $25 out of pocket. So there are a significant amount of drugs that are not listed on that Alberta Drug Benefit list, which are not covered through the Alberta Seniors Drug Plan. And then if you have one of like our plans, then we would just cover you up to the 80% of whatever the drug was for eligible prescriptions. If you're not 65 and join our retiree plan, we'll also cover up to 80% of those eligible drugs. So no worries, it kind of works in tandem a little bit more with the Alberta Drug Plan for Seniors. But when you are 65, you're able to have the Alberta Drug Plan for Seniors and able to have ARTA Benefit Plan. When you coordinate the two plans, your out-of-pocket expenses will be 100% covered if your drugs are listed on that drug list. So for our build your own plans, again, we're just going to go over a brief kind of overview of them all. We have two plans that do not include travel insurance. That's HealthWise and HealthWise Plus. And then the two plans that include the 92-day travel coverage are Total Health and Ultimate Health. The HealthWise and Total Health plans are core plans, where the HealthWise Plus and the Ultimate Health plans are more enhanced plans. Again, all four of our extended healthcare plan options offer single, couple, and family coverage, and they are all separate maximums for each person. With the build your own plans, you will need to choose your annual prescription maximum of either $1,200 or $2,000. So that's where we say it's really good to go to your pharmacist, kind of figure out where you need your levels. Again, if you need to move up, that's fine. But this maximum does stretch a long way when you are coordinating it with the Alberta Coverage for Seniors plan and the ARTA plan. And like I said, they cover their percent, and then we would just cover you up to the 80% of whatever. So if you work it out, a lot of the times your drugs are covered at 100%. We really say that just to choose the best plan that fits your life and health situation. So if you don't know what you're doing, that's where our member services team is really, really great to sit down with, have a conversation. Maybe they have a better idea. You can bring in what you need. They can give you a better idea of what plans you are also looking for. So the HealthWise and Ultimate Health plans have some higher maximums for our paramedical services, your vision care, your hearing aids, and your defined lifestyle medications. So again, those defined lifestyle medications are your hair loss, your weight loss, and your erectile dysfunction. But as you can see, the HealthWise Plus and the Ultimate Health do have higher maximums. So your vision care for your HealthWise and your Total Health is $425 for 24 months versus the $550 for 24 months. And then defined lifestyle medications, it's not included for your HealthWise and Total Health, but you get 50% up to $150 a year for your HealthWise Plus and Ultimate Health plans. One of the great things about ARTA is you get a few additional resources with your benefit plans. That's for any of our benefit plans. We have Maple, a virtual physician service. So this is where you can meet with physicians online, get prescriptions, get lab requisitions, all of that stuff. It's really great for people who don't have access to a doctor close to them, or you're too sick to leave your house, you don't want to infect anyone. Maple is really great for those people to use. You just sit in front of your computer like I am right now and you talk to a virtual doctor. With InkBot, which is our member assistance program, all members get 5 hours of counseling per member free per year. But then if you want to use it on top of that 5 hours, you can, but a great way to start looking into counseling options if that's something that you're needing. And then ARTA Cares, which is our healthcare navigation. This is just extra support for illness or injury or surgery, or even chronic illnesses concerns. There's people there to kind of help you walk you through all of those things. So our emergency travel coverage. So if you choose to take part in one of the some of the plans that offer travel insurance. So that's any of our comprehensive plans for the under age 65 that I listed, or our total health and ultimate health plans in the build your own sector. You have access to one of the best emergency travel plans in Canada. So the ARTA travel plan is unique as we do not have stability or pre-existing condition clauses built into our plan. Most travel insurance plans require a pre-existing medical condition to be stable for 90 to 365 days. So when you're looking at that kind of stuff, do look at that, but we don't have that, so that's really great. The ARTA travel insurance indicates that all travel-related medical emergencies must be considered sudden and unforeseen. So this means that you had no way of knowing a medical emergency would occur. If you had a change in medication or you're recovering from a previous medical episode and both you and your doctor feel that you are healthy enough to travel, go on your vacation, enjoy it, have a great time. But if something were to happen to you because of whatever circumstances, that would be seen as sudden and unforeseen because both you and your doctor had a conversation and said you were healthy to go. Sorry. Our travel plans offer up to $10,000 per year per insured person for trip cancellation. There are a number of reasons why a trip would need to be canceled and covered, such as illness to you or a travel partner, or something happened to your residence, like a fire or a flood, you were unable to leave, or a natural disaster occurred. You can find all of the approved trip cancellation requirements on our website. And so you will also be covered for up to 92-day trips outside of your province of residence. But that means once you cross back into your province of residence, that 92-day automatically resets. So we have lots of members who like to go down to Palm Springs and snowbird down there. And what they'll do instead of buying supplementary travel insurance is they'll usually just come right back up to Alberta. They'll stay in the airport, they'll purchase a coffee to prove that they were here, and they'll just get on their next flight down to Phoenix and go back down to Phoenix. So the second that they stepped into that province, it's an automatic reset for that 92 days. We usually just say, have a proof of purchase or something showing that you were here in the province, and then you head back down, good to go, your 92 days resets. We do know not everybody has the money to necessarily get on a flight, come back, and go back to where you are. So that is why we do have supplementary travel insurance. It's available in 15-day increments up to 212 days that you can purchase. You will be covered up to a lifetime maximum of $5 million. We have not had any member come close to reaching this maximum, but we just want to ensure our members are always covered if needed. And then, yeah, if you, sorry, I should go back to the supplementary travel insurance. If you know that you are going to have a longer trip, we prefer you purchase it kind of before your trip. However, if you're on your vacation and Edmonton's weather looks terrible and you don't want to come back, you can just call us and add it while you're on your trip. That's not a problem as well. And then really great to note, there's no termination age with our emergency travel. So some places do have a termination age on their emergency travel specifically. Usually it's about 80 years old where they terminate. We don't have a termination age. So if you have a plan that has emergency travel, you're in your 80s, you can still travel. I would love that for you. You can do so. There's no termination age, so there's no worry about that with our emergency travel. And so kind of back to our build your own plans, they don't include dental. So this is something that you have to look at adding on top of if you are interested. If you were to get a build your own plan right off the bat and you said, you know what, I don't want dental, that's no problem. You don't have to take it. But if you want it at any time, you can opt in at any time. If you say no to it just right now, it doesn't mean you won't ever be able to get back onto a dental plan. You can come and get a dental plan at any time. So we offer 3 standalone dental care plan options. You do not have to be enrolled to take for a build your own plan. If you just wanted to take the dental, you could, but you just need to be an eligible ARTA member. So option A, this is the most comprehensive plan of the 3 plans. With option A, you receive 80% coverage for your basic, preventative, and minor restorative work. You receive 80% for your minor restorative work, such as your root canals and all of that, and then 50% for your major restorative work, so your dentures, your implants, and your crowns. Option B, again, 80% for minor, 80% for you can see this chart anyways, but you get none for major restorative. And then option C, again, you're 80% for your basic, 65% for your minor restorative as your root canals and everything like that. And the overall maximums you can see are on the corner. That's for each, like basic is unlimited, minor restorative is $750, major restorative is $1,600. Like I said, you can choose to add dental coverage whenever you want. Just know that if you add it halfway through the year, your rates are prorated back to January 1st. And then once January 1st comes, it kind of all resets. You can pick a plan at any time. Again, if you need to move up in coverage, you can. You're just locked in for that 24 months before you can wait to lower your coverage if you need it. So that's a little bit about our plans and a little bit about ARTA. We have a great website, artabenefits.net. This is where you can build your benefit plan. So this website will ask you a series of questions, such as, are you over or under 65? Do you want emergency travel? Do you not? Do you need dental? Do you not need dental? And then a chart will populate with the plans that we believe are the best ones for you and that are available to you. And then the premiums would be associated with each plans on this website. So great place to go, artabenefits.net. To compare benefit plans, compare rates. We have a comparison chart on there that you can look at as well. Really great first step if you're just wanting to start looking. If you have any further questions, if you did it kind of shows you what plan it thinks you should take. You can apply for that right then and there. But if you have any further questions, again, you can book appointments with our member services team, either in Edmonton or Calgary or online, or give us a call. I know sometimes it's easier to book an appointment though, to kind of sit down and have that, but our phone lines are open. Our member services team is wonderful and they can always answer any phone calls as well. So that's kind of it. A little run through of our plan. I know it's a lot to look through. So that artabenefits.net is a really great website to go to. That will have all of our plans and everything laid out there for you to kind of go through, all of the benefit booklets and things like that. That being said, if you do want an enrollment kit, so that's going to be our plan options brochures, our rate sheet, some membership advantages, things, all of the hard copy stuff, you can just send an email to join@arta.net. Or if you have any further in-depth harder questions, you can also look at info@arta.net. So thank you guys so much. That's kind of it here for me today.